Hi, everybody. Welcome to tonight's intended parent coaching call and our podcast. It is fantastic to have all of you here with us to learn about cord blood banking, something I actually don't know a whole lot about. As a mom of 5, I feel like I missed the boat on it. So today I am catching up with Dr. Librak to really get into the nitty-gritty of why cord blood banking makes sense when you are using or having the assistance of an egg donor and a gestational carrier, what it means, how it works, and how Create Fertility Center and Dr. Librak have created a state-of-the-art, the top-ranked cord blood program in Canada. I'm super excited. So we're just going to give people a moment to join. And as you're joining, I will introduce Dr. Librak. He's the founder and director of the Create Fertility Center and Create's Cord Blood Bank in Toronto. He's a professor in the Department of Obstetrics and Gynecology at the University of Toronto and holds cross appointments with the Department of Physiology and Institute of Medical Sciences. He is currently the chair of the Ontario Medical Association. Dr. Librak played an integral role in the establishment of the reproductive biology clinical and research program at Women's College Hospital in 1991, and since then has shown unparalleled leadership and commitment and made significant contributions to current fertility practice in Canada. He served as division head of reproductive endocrinology and infertility at Sunnybrook Health Sciences Center and Women's College Hospital for 25 years. Dr. Librak also served on the committees for development of standards for the Canadian Royal College REI Fellowship and for development of the CPSO standards for REI practice in Ontario. Dr. Librak was the chair of Ontario Medical Association Reproductive Biology from 2004 to 2016. He co-founded the Canadian Fertility and Andrology Society IVF Improvement Committee in 2004 and has presented analysis of clinic-specific data at the IVF directors meeting for the past 12 years. You know, the introduction goes on and really for the purposes of this podcast and this interview, I really want to focus, Dr. Librak, on cord blood banking. And I think I did a little post today and was shocked. We had, over 30 questions sent in, some of them duplicates, but I'd love to get right to it. What is cord blood banking?
Okay, this is a great question. So basically, this all comes down to the basic science of the stem cell. An embryo starts out as a stem cell because it can make every part of our body, including the placenta and the umbilical cord. And when a baby is born, all those cells from that embryo created the baby, every part of their body. And we are born with these stem cells right from the time of birth. And our stem cells from our birth time are much more potent and have much better ability to repair our tissues than they do when we're elderly. So if you think about it, if you had the cells from the time you're born to have through your whole lifetime to use, what an incredible gift that you could give your child. Think about how well a baby can heal compared to an elderly person. So the umbilical cord contains blood vessels where blood from the baby are streaming through there. And so when we cut the umbilical cord, we can take that blood and it has stem cells from the baby that are the perfect match for that child. I'm going to stop there and see if you have more questions regarding that.
So when you say it's a perfect match for the child, what would that mean for a child that gets sick, or a baby that gets sick, or an adult that gets sick? And why would someone keep this? Like, it seems kind of crazy to me.
Well, because now there are over 80 different diseases that are treatable with cord blood as we speak in children and now adults.
Okay.
And those diseases run from things like leukemias and lymphomas. We always hear about people that want to find a match for their child that has a leukemia. Well, this is a perfect match for your child. And think about it, if you use an egg donor or sperm donor to create your child, you don't have that part of your family to be able to get those stem cells if they ever needed it. So this gives that perfect match. You really have the ability to use those cells for that child during their lifetime. And new diseases are being discovered all the time. For example, recently they found that some children with diabetes could completely get off their insulin or have a much lower need for it by having their cord blood transplanted. They're also finding that children have had brain injuries like cerebral palsy and other oxygen deprivation problems that can cause severe lifelong problems for the child have done way better after receiving their cord blood. In fact, we had a child that was talked about in the National Post newspaper in Canada, which is a national newspaper, that received cord blood from our bank, and that child had a brain injury and is doing way better than ever expected. And one very exciting area that's being researched in this field is in Duke University. They have a $55 million trial looking at these cells in autism. And there is no treatment, as most of you probably know, for autism. So they've been used to transplant back to the child that has developed autism to try to help them reduce their symptoms and even get to almost a cure of that condition. And I saw them present not too many, well, before COVID, but a few years ago, and I was really blown away by some of the advances they're making in this field. So that's an incredible area that these cells could be used for. And then there's also studying disease of elderly people like heart disease, stroke, diabetes, Alzheimer's, spinal cord injuries. So again, those cells could potentially be used throughout the lifetime of that child. And I always also recommend that you bank cells from each child, because for some conditions, it's better to have your own cells as a transplant. For example, autism would be an example. And for some conditions, it's better to have your siblings. An example would be certain kinds of leukemias. So it's important to do it for every child that you have, and that way you have these stem cells for their whole lifetime to be able to use.
Okay, so tell me how it works. Like, do we send something to the doctor? Do we register? Like, tell me, like, how do they get these stem cells? Does it delay the birth process? Is it intrusive to the baby? Like, give me the details on that.
Of course. So let me talk about what happens during the birth, and we'll talk about how you can sign up to do that. That we'll talk about after. So at the time the baby's born, the umbilical cord is cut, as it is done for every child that's born. And then the baby's born. It's already alive. It's in the bassinet. It's already there. But after that, what comes out after is called the afterbirth, or the placenta umbilical cord is then expelled from the mom's uterus or the gestational carrier, whoever is going to be carrying the baby.
Okay.
And we can collect that blood before it gets expelled and have that blood stored for the baby's future use as a stem cell. Now, I want to talk about another kind of cell. We were the first in the world to discover this, and that's the cells from the umbilical cord tissue itself. And those cells have different properties, and we call them peristem. They're from around the blood vessels in the cord. And those have the different properties. Cord blood is more like for your organs, like your brain, bone marrow, liver, kidneys, and so on. Whereas for cord tissue, it's more your body structures, like your bones, your cartilage, your muscle, like your heart muscle. And in fact, we have a trial that's going to be starting soon in Ottawa, in Canada, at the Ottawa Heart Institute, to use these kinds of cells for people that have heart disease. So it's an incredible advance that we can use these potential cells to help people. We have very good data from animal studies that shows that it does benefit those people with heart disease. So we're really excited about that trial. So that's called the peristem. In fact, I couldn't even do the peristem for my own kids, which I feel bad about, but they're older and it wasn't even available back then. But every doctor in our clinic has done both the cord blood and the cord tissue peristem cells for all of their children. So they believe in this and they feel that it's really important to do it for their child, just like I do. And they had the opportunity to do both, which they're very lucky to have. So I think you want to consider doing both the cord blood and the cord tissue peristem for all of your children.
Okay, so if somebody wants to do this, like, do they send something to their doctor? Is there like a kit? Like, how do you how do you do it? Like physically, how does it all work?
So what you do, it's very simple. You sign up with our cord blood bank,
Okay.
called Create Cord Blood Bank, and you can look it up. Google.
We'll
Create
send the
Cord Blood
information to
Bank.
everyone.
You'll find all the
Yeah.
information, and you register online, and you tell them you want to do both the cord blood and the cord tissue, or one or the other, and basically it tells you the cost. If you're a patient of Create, we actually offer a discount, so that's nice. But anyone else can do it. You can also pay it if you want to do a payment plan. You can. We'll work with you. We don't want someone not to do this for their child just because it's not affordable right now. So we allow them to pay it over time if that's what you need to do. And then there's a yearly storage fee that you pay as the cord blood is being stored. And then basically, I always say when the kid's 18, they're supposed to pay for it, except my son's 24 and I'm still paying for him, but he's in university. But eventually, as an adult, the child could eventually pay for their own cord blood storage.
Okay, so once people sign up, they pay. Do they receive something, or their doctor already has the kit to do the thing?
No. So they do receive a kit. So what we do is once they have paid and they're ready to go, we ship the kit to them, or if they're local to us, obviously they can come and pick it up, but we can ship the kit to you as part, and then you basically would bring it, whoever's going to be giving birth would be bringing it to the hospital at the time of the birth, and all those stem cells are taken at the time of the birth by the doctor or midwife that's delivering the baby. And then it's shipped back to us, and we store it in our state-of-the-art cord blood facility.
So do doctors and midwives sort of across Canada, like, do they know what this is? Do they know how to do it? Like, is it, pretty foolproof?
It's very simple, and virtually every doctor or midwife in Canada has done this at some point.
Okay, excellent. And so now that we know sort of
One more
how,
thing I should mention about the cost. Occasionally, some hospitals or doctors do charge a fee for them to do it. You just have to be aware that's separate from us. But
Okay.
there could be a small fee for that. Just I want to make sure people know that, not just
Okay. Absolutely. So I'm going to get into the questions. We have some questions in our comment section, and then I also have some questions that were sent to us today. So the first question, thank you, Nicholas, for asking. The amount of stem cells that are taken at birth, is that enough for multiple treatments if needed?
That's a wonderful question. I wish I should have brought a bag that we collect the cord blood in, but it has multiple compartments. And the other beauty of the stem cells in the cord and in the cord tissue cells, the peristem, is they can be expanded. We now have technology to expand them so it could be used for multiple purposes.
Okay. Nicholas, if you have a follow-up, please post it below as well. So my other question is, for many clients, they're outside of Ontario or they're outside of Canada, and their surrogate, for the purposes of this webinar, their surrogate is in Canada. Can people, who live in the UK or live in France, can they do this? And then if they need the cells, how do the cells get to them? Or does their sick child or whoever have to come here for treatment?
No, we can ship the cells anywhere in the world. They're yours. We're just storing them for you, for your use. So wherever your child is getting treatment that requires it, or as an adult later on in life, they can have that shipped to them at any time, no problem, anywhere, pretty well anywhere in the world.
Okay, and is it similar? Would you say it's similar to, many of our clients who are shipping their embryos into Canada? Would it be a similar type of shipping out of Canada?
Exactly the same. We have companies that ship anywhere in the world, and we can easily send it anywhere you want.
Okay, amazing. Okay, so the next question is from a client that works with an egg donor, and they want to know if they need their egg donor's consent to store this tissue or these cells.
Absolutely not. Once you're a baby, it's your baby. It's their cells, really. There's no need for that egg donor to consent to anything regarding this.
Okay, excellent. Thank you. Again, if anyone has questions, please ask. Okay, someone is asking, do they tell, like, would you tell the pediatrician that you have these and then they would deem that you would need them? Or how would someone know that their child has something, an illness or something going on that then they could use them? Like, how do people know what this works for?
That's a great question. I think it depends on the disease that they have, and the longest period of time it's been used for leukemias and other types of bone marrow disorders in babies, because that's one of the most common cancers in children. So that's well established. And some of these other conditions, I mean, you can basically look up yourself. And if you looked up diabetes and cord blood, or autism and cord blood, or cerebral palsy, you'll see the studies that are being done. Sometimes you'll have to go to a specific place that does that kind of treatment. For example, the Duke University's treatment is done in the US and currently is being in a huge trial, as I mentioned. So it depends on the particular disease that they encounter. And there are many genetic conditions as well that could be treated as well with it. For example, sickle cell anemia is an example that's also been treated with it. Thalassemia. There are many diseases. There are too many to list on tonight, but it's easily information found on the internet and elsewhere.
Okay, the next question is, do you test the stem cells when you receive them to know if they are viable?
We sure do. We test
Okay.
them, we look at them, we also make sure there's no bacterial contamination, because at birth, obviously, there's chance of bacterial contamination. We know about that, and we can use the cells once we know that they are viable. Yes.
Okay. The next question is more of a curious one. They are saying, the person is asking me, is this a liter of blood, a teaspoon of blood? Like, and how do you get enough cells to treat something if it is such a small amount of blood? Do you multiply it?
Yeah, I mean, a child would need less cells than a full adult, but as I mentioned, you can expand the cells to use for an adult, and each disease might require a different number of cells, so it's a little bit more complicated, that question to answer, but
Okay.
I think it depends on the condition. But usually there's enough to treat an adult or a child as needed, and there would be ways to expand the cells to use for all these purposes. And like I said, there are maybe diseases that are better treated with the cord tissue cells, the peristem, than with the cord blood. And there are even conditions where you use a combination. That's even better. So there's lots of combinations and permutations here.
Okay. The next question from Hassan, can these cells be collected at home for home birth cases?
Yes, they could. If the midwife is familiar of how to do it, and most
Okay.
would have no trouble doing that, absolutely.
Okay, excellent. Let me just check the rest
And
of my.
the kit is very simple for even if a doctor is doing it for the first time, they should have no trouble doing it. It explains everything step by step. That it's really, and many times nurses do this in the OR or in the delivery room, so it can be done for cesarean or vaginal birth as well. The only time when it might be difficult is when there's a dire emergency where it has to be a cesarean, like, done immediately, and it might not be time to do it, but that would be a very rare case. But even in those cases, the cord tissue cells could easily be collected anyways.
Okay, excellent. Hassan, if you had any other questions, follow up on that, please post them there. My next question is there a way to take these cells from a baby you already have? These people are saying we missed it, we didn't know about this, but could we still do it?
Yeah, unfortunately, no, because they're really only available at the time of birth. After that, really, you'd be looking at bone marrow from a baby or something like that if they had a leukemia or something like that. But it's not possible to do it after the birth. So it has to be done. You have to consider this and sign up and do this before the baby's born.
Okay, excellent. And the next question is, okay, is there a guarantee that, is there a guarantee that these treatments can cure or help with these medical issues? Do we know for sure?
Well, there's never, you can't guarantee. Obviously, some things, some diseases are just, you treat it and you try your best. Like even transplants for leukemias and so on don't always work for every child.
Okay.
But children are very resilient, and they respond so well to some of these treatments, that the chance of cure from a cord blood transplant can be much higher than a bone marrow transplant. So there, and also you don't require as close a match. With bone marrow, you're required to have a perfect match almost to be able to transplant. With cord blood, it doesn't require it to be such a close match, which is one of the beauties. That's why it's very often can be used for sibling as well.
Okay. Gareth has a question, and it says, for permission to access the cells, will the child they come from always have automatic access to them, or do forms have to be filled in saying who could have access to these cells?
Absolutely. These are your cells to use as you wish. They're for your family. We call it family banking. There are public banks where people just donate them and they go to that public bank. But you have, after it goes to public bank, you have no access to that. It goes to anyone that needs it at the time, and very likely to be gone if you ever needed it for your own child. So the beauty of family banking is this is your cells to use as you wish. If you ever want to discard them or do whatever you want with them, then you can do that. You can donate them someday to a family, to a public bank, whatever you want it to do. But these are your cells forever until you don't want to use them anymore.
Okay. And the next question I have is, how does this compare, or can this be used similarly to a blood transfusion if someone had a medical emergency, or is this something completely different, only used for like a medical condition, not a medical emergency?
Yeah, it's not for blood transfusion because this is cord blood is stem cells. It's a very early onset. You can't really use an adult or a child this as a blood transfusion. So that's usually not a problem because blood transfusions can be matched very easily across different people. So
Okay.
it wouldn't be used for that. This is a stem cell. This is to regenerate tissue that's damaged by disease, either because of injury, because of a disease process, like heart disease or something like that, or a genetic condition, or some type of cancer, and so on.
Okay. Hassan has another question. Can these cells be collected if there is a water birth?
If there's a water birth,
Like the person has the baby in the tub, or
yeah, they can. Once the baby's born, though, the person would have to obviously come out of the tub to collect it. Yeah. But
Okay.
Yes.
Okay, excellent. And my next question is, at what stage of a pregnancy is it ideal to sign up and have the kit ready? We are superstitious people. We don't want to do this too early, and we also don't want to miss the opportunity.
Right. So I wouldn't probably do it in the first trimester because you obviously want to know it's not going to be a miscarriage or anything like that. So I would say anywhere towards the late second trimester, which is usually after 20 weeks, that's probably the best time. Anytime between 20 weeks and 30, 35. You don't want to wait till the last minute. We have
Right.
people who oh my God, I forgot to do cord blood and sign up, and they're in labor, and we can sometimes get an emergency kit to them. We do give emergency kits to some hospitals so they can do it, but you don't want to be doing this last minute. You want to plan ahead.
Okay. And the follow-up question to that, is there anything that our surrogate will need to fill out, or anything that she will have to do in order for us to get these cells at the hospital?
Yeah, there is for us to do this, Health Canada requires a questionnaire that's filled out by all people involved, and the cord blood bank can help you with that. It's not a problem at all.
Okay, excellent. My next question is interesting, and I have my fingers crossed that the answer is what we want to know about, and it is, can we do delayed cord clamping and cord blood collection?
Yes, you can.
Okay.
There may be a smaller yield of cells if you do that.
Okay.
There's still lot of controversy about delayed cord
I
clamp.
know.
All of us probably did not have delayed cord clamping, and we're all okay, I think, relatively speaking. So there's a lot of data that shows that that's probably doesn't make much difference. Although there are some data that shows if the baby's very premature, it may help to do delayed cord clamping. But if it is done, yes, it can be collected, but the yield might be lower.
Okay. And I think that, for people that are listening and, have a gestational carrier, our suggestion always is that when you get to week 24, which is when we know viability, is when we see viability, we like our surrogates to have the kit by that time so that they can go over any questions they have with the cord blood program, which, by the way, is fantastic. There's a 1-800 number you call, the surrogates call. Maybe you'll have a call with your surrogate, with those, the people there at the cord blood collection or cord blood program, to ensure that that your surrogate understands, because while we want all of you to be present at the birth, we know that, right now there's a blizzard in Toronto, things happen. And so we want to make sure that your surrogate is really educated, understands, the kit comes in the mail. We don't want to leave it in the car when it's cold. We want to have it in the house. We want to have it with our birth bag. We want to, make sure we take it to the hospital. And I think having the conversations early on with the surrogate's care provider, so that the care provider doesn't just get to the hospital and see this kit in the corner, that the conversation is had, and that the surrogate understands, what she might need to do in terms of filling out paperwork, and that the doctor is aware that this is something important to not only the surrogate in terms of, she of course wants this baby to have every chance in life to be healthy, and life happens. And I know for myself, I still don't, I get it. I understand everything that Dr. Liebrecht's saying, but it is just so amazing to me that, that all of these, I think he said 80 conditions, diseases are being studied, or we've seen marked improvement with this treatment. So it really is just amazing. My next question, just one moment. My next question, I think you kind of touched on at the beginning, but you mentioned this is family banking. And so, if someone has a child who has cancer and they have a new baby, can those cells be used for the sick or unwell child that's older than that child being born?
Yes. So
Okay.
It's not just when they're a baby, it's through their whole lifetime. And basically, as I said, if you do both the cord blood and the cord tissue, you have an opportunity. I was saying that we were doing a trial for heart disease. Obviously, that's mostly elderly people using these cells. So imagine having those cells from the time you're born to use for your whole lifetime to treat many, many different diseases you may encounter in your lifetime. So it's not just for babies; it is for children and then even into adulthood.
Okay. And my question was, for a sibling, can this be used? I know you had sort of touched on it at the beginning, but can this be used for the sibling, the parent, if they were? So I guess if it's the parent,
Not the parent.
If someone had a surrogate, and an egg donor and a sperm donor, it wouldn't help the parent. It would, because they're not.
Even if it was the parents, it was their own gametes, their own sperm and blood and eggs. It can't really be used for the parents, because the parents, remember, are from a separate family, and the baby comes combined from the two parents. So their genes are combined from the two parents. Their sibling is also combined from the parents. So you can use it for a sibling, but not for a parent. No.
Huh. Okay. That's interesting.
It'd be very unlikely you would.
Right. Yeah. No, it's fascinating. It really is. Thank you so much, Dr. Liebrecht. I learned so much. If you are watching this live, you'll get an email with the information of how to connect with Create's Cord Blood program. If you are listening to this in the recorded version, in a moment from now, we will have it up on the screen with how to reach out. If you are working with a gestational carrier who is past the 25-week mark, do not worry. Reach out to them, reach out to the agency that you're working with in order to put this together very quickly. We all want the best for any children who are born through surrogacy, egg donation, sperm donation. And so we really hope that this information was informative, and we look forward to, updates and studies, and we will be providing more information. We will also put that National Post article in the comments, as well as when we send out the recording. So thank you so much, Dr. Liebrecht. It was an absolute pleasure.
Pleasure.